All right, future nurses, let's jump right in. We're talking about something that's practically guaranteed to show up on your exams, and, more importantly, something you need to spot in a clinical setting: measles. Think of this as your high-yield, no-fluff briefing to really nail the core concepts. Let's do this.
So, imagine this. A child comes into your clinic, totally flushed, fever spiking, and there's this weird rash starting to pop up. Your brain has to kick into high gear, right? What are you thinking? What's your next move? Well, this explainer is going to be your roadmap for that exact situation, taking you all the way from risk factors to the essential nursing care you'll provide. Okay, first things first. Before we even whisper the word diagnosis, we have to figure out who is most likely to get this. That's why we always start with risk factors. It's like being a detective. You're gathering clues that help you narrow down the list of suspects from the get-go.
And this is where it gets really practical. You've got two buckets of risk factors. On one side, you have the modifiable ones, the things we can actually do something about. The number one culprit here? Incomplete MMR immunization. That's a huge opportunity for patient education. Crowded living spaces and not getting enough vitamin A also fit in here. Then, on the other side, you have the non-modifiable risks. Things like being very young with an immune system that's still under construction. We can't change that, but we sure have to be aware of it.
So we know who's at risk, but what is this virus actually doing inside the body? How does it cause all this chaos? Let's trace the journey of the Morbillivirus, step by step, to see how that tiny invader creates the classic signs and symptoms we see in our patients.
So, meet the villain of our story, the Morbillivirus. This thing is airborne, which is exactly why it's so contagious. I mean, think about it. A simple cough or sneeze becomes a delivery system. The virus just floats through the air, lands in someone's respiratory tract, and boom, the invasion begins.
And this virus has a clear game plan. Step 1, it gets inhaled and sets up shop. Step 2, it doesn't just hang out there. It moves to the nearby lymph tissue. Step 3, it uses the bloodstream as a superhighway to go systemic. We call that viraemia. And finally, Step 4, the body's immune system freaks out and launches a huge counterattack. And that big reaction is actually what causes the famous rash. But, and this is a big but, there's a major catch.
Okay, if you remember one thing from this section, let it be this. Measles causes something called immune amnesia. It's wild. The virus literally seeks out and destroys your immune system's memory cells, the very cells that remember how to fight off diseases you've had before. It's like it wipes the slate clean. And this is exactly why patients with measles are so vulnerable to other nasty secondary infections, especially bacterial pneumonia.
All right, we've got the microscopic story down. Now, let's zoom out. What are you actually going to see? What are the telltale signs you'll be charting on? This is all about connecting that deep science to the clinical picture right in front of you.
For your exams and for real life, you have to know the 3 C's. Just burn it into your brain. Cough, coryza, which is just a fancy term for a super runny nose, and conjunctivitis, red weepy eyes. Then you add the 2 big giveaways. Koplik spots, these tiny white spots inside the cheek, and that classic maculopapular rash that starts on the head and works its way down. You see all that together, you should be thinking measles.
But, of course, a strong suspicion isn't a final answer. We need to confirm it. So here's our diagnostic toolkit. The gold standard is an RT-PCR test, which looks for the virus's genetic material. Serology, looking for those IgM antibodies, tells us it's an active infection. A complete blood count, or CBC, will usually show leukopenia, a drop in white blood cells, which is direct proof of that immune suppression we talked about. And if you're worried about pneumonia, a chest X-ray is the way to go.
Okay, diagnosis is confirmed. Now for the most important part. What are we going to do about it? This section is all about your role. It's about treatment, management, and, so importantly, preventing this thing from spreading. The first thing you need to understand is that treatment is all about supportive care. We aren't fighting the virus directly. Instead, we're supporting the patient's body so it can win the fight. That means rest, pushing fluids like crazy to stay hydrated, and using antipyretics to keep the fever manageable. Vitamin A supplements are also key. They've been shown to really help the immune response. And I'm going to say this loud and clear, antibiotics are only for secondary bacterial infections, not the measles virus itself.
And let's just make this crystal clear so there's absolutely no confusion. There is no specific antiviral drug for measles. None. Our entire game plan is to support the body and manage any complications that pop up. That's it.
So what does your nursing playbook look like at the bedside? It boils down to 4 priorities. Number 1, isolate.
This is airborne, so that means airborne precautions, negative pressure room, N95 mask, the whole shebang, non-negotiable. 2, monitor. You're watching vitals like a hawk, looking for any sign of trouble, especially breathing problems. 3, support. That's your hydration, your fever control, your comfort measures. And 4, educate. This is huge. You have to teach caregivers about infection control and, when it's appropriate, about the power of vaccination. Which brings us to our final, really important question. We have this amazing, super effective vaccine. So why is it still absolutely critical for you to know all this? It's because you, as a nurse, are on the absolute front lines of public health. Your ability to spot this, to manage it safely, and to educate families is a vital part of the shield that protects not just your patient, but our entire community. Thanks for diving into this with me.